not all falls are the same. And that's why we want to spend time on helping you to appreciate that there are different types of falls. But all of the falls that someone has in your care can indeed result in injury. So the accidental falls are falls that happen because of an unsafe environment. And it's our responsibility when someone comes into our care and in long-term care settings, you get to have them in your care for longer periods of time, and you make that environment as home-like as you can. But you also have to create that environment so that it really fits the needs of your residents and it's as safe as possible. So if anybody falls in your care because of an unsafe environment, then that's going to be an accidental fall. If someone falls in your care because of the risk factors that are inherent to their person, like we just had on that prior slide, their impaired vision, their weakness, their balance problems, that's going to be the anticipated physiological falls. So those are the two types of falls that you're trying to do everything you can to prevent. Those are the two types of falls that are preventable. The third type of fall that you see here on this slide is the unanticipated physiological fall, and that's the fall that happens because someone has a sudden heart attack or a stroke or a seizure. And they could be in your care, you could be walking them, you could be holding them, but they have this a sudden medical event and they are going to go down. Hopefully, if you are there, then they would have an assisted fall. But that's the type of fall that you can't prevent. So when we look at doing everything we can and getting clinical, it has to have a focus on the environment of care and also the person and the risk factors that that person has, and then the interaction between the two. Because you can have someone who has great safety awareness, great judgment, but if they're getting up from a bed that's too low and they can't manage that because they've got muscle weakness, and they could fall, and the corrective action would be bed height. So that would be an environmental fix, and that would be related to preventing an accidental fall. If you have someone who's falling because their blood pressure is starting to drop when they're getting up to start walking, and they don't get dizzy because not everybody's going to tell you they're getting dizzy, or you don't know that their knees are starting to buckle until they actually start buckle, that's going to be an anticipated physiological fall inherent to the person.